Well, good afternoon, everyone. Hope everybody had a good weekend. Today I want to talk about where we've been, where we are today, and where we're going in the future in regard to our battle with COVID-19. But before I do that, I would like to remind all of us, myself included, of three things. And I would ask for you to keep these in mind as we talk about this today and as we talk about this in the future, because I think these three things are very, very important. One, you have done an amazing job. Staying at home, staying apart, the things that we ask you to do, Ohioans have stepped up. And candidly, we are where we are today, where we can start coming back, start getting the economy moving, start getting people back to work. We are here because of what you have done. It's mattered. You've got the job done. Number two, second fact. The coronavirus is still here. It is just as dangerous as it's ever been. It is still living amongst us. I was thinking about this weekend, and I thought back to when Fran and I were children growing up. Saturday morning, we'd go to catechism, St. Paul Catholic Church in Yellow Springs, and the nuns taught us. And I remember, it's kind of seared in my memory, the nuns talking about the devil, and the devil is roaming the world, searching for souls. I'm not saying that the virus is the devil. I've described it as a monster. But it is searching, and it's searching for bodies. And the way it does it, of course, is going from one body to the other. And many of the things that you have done, you have dramatically slowed this process. But it's still there. And the virus is still out. It's still in Ohio, just as dangerous as it was before. Third fact, the tools that we have had to slow it down, to break it from going from one person to another, are still the same as they've always been. We actually have a couple of new ones, but the essential ones, the most important ones, are still the same. What are they? Distance, distance, distance. Keeping that distance. Second, washing your hands. Third, the normal sanitation of surfaces and other things. And what I normally call a mask. I don't know if it's a true mask or not, but it's something to cover our face, a face covering. And these are the things that we have used successfully, and these are the things that we're going to have to continue to do as we start moving forward in the economy. I had a conversation, and first of all, I want to thank our business group. We had men and women from bigger companies, mid-sized companies, small companies, and asked them to come together and help us in coming up with the right protocols. And frankly, we've learned from things that have occurred with businesses that were allowed to stay open and some of the things that they have done, where they've done a really, really good job. But the person who headed that up was Frank Sullivan. And I had a conversation with Frank this morning, had a lot of conversations with him as this has been being put together, something that Lieutenant Governor worked on daily. But Frank said to me, you know, Mike, he says, the idea that we can't do two things at once in Ohio is crazy. We're Ohioans. We can do two things at once. We can get this economy moving back, at the same time continue to protect each other and protect our communities. So let's talk a little bit about that. And let me start with kind of where we are and what we've accomplished. And I want to talk, as you'll see some of these things I'm going to show you, they directly relate to getting us moving in May and getting us moving forward. So I'm going to start, Eric, if I could, with the COVID-19 statistics that we just got a few minutes ago. And I'll start cases. As you can see, the total number of cases. But what I always look at is over here to this side. 5-day reported case average. So you go back in 5 days and look at what we've seen. What's that average? So let's start with cases. 5-day reported average, go back 5 days, 442. That was the average for each day. Last 24 hours, 362. So you can see we're going in the right direction, down. Deaths. Deaths are a lagging indicator. And so these are always far behind whatever else is occurring. In the last 24 hours, what was reported is the deaths of 25 of our fellow citizens were reported. The 5-day average, going back 5 days, was 29. Hospitalizations, again, something that I always want to look at. And these are things I look at every morning. Last 24-hour reported hospitalizations, new ones, 54. 5-day average was 70. Again, that one is going in the right direction. ICU admissions, last 24 hours, 26. 5-day average is 20. So you can see with these lines that what you have done has made a difference. Now, we're not there. We haven't had 2 weeks coming down, but we're moving. We're moving in the right direction. And it's because of what you have done, and that is just so very, very important. Let me share with you something else. And remember, I've talked about May as a crucial month. We needed to fight this virus 2 additional things, besides what you have been doing. We need 2 additional things. We need to ramp up testing dramatically, and we needed at the same time to do the tracing. So I want to start with the testing. Remember last week we talked about, early in the week, I talked about asking Governor Celeste, former Governor Taft, to come in and help us. They did that. They pulled together with our team. We were able to get an agreement with Thermo Fisher in regard to a problem that we've had and other states have had, and that is the inability to get enough reagent. That was a major breakthrough. Also, last week, the Manufacturer Alliance, specifically Road Dental, now we have come up with a method to consistently make a lot more swabs every single day. So those 2 things coming together, this is what May looks like. This is what our projection is. We'll start April 29th, that's this Wednesday, and you'll see at the top in white daily testing totals. And you'll see each week from then where we go. So April 29th, that week, we will be able that for that next 7 days, daily testing at about 7,200 a day. That's significantly above what we've had. A weekly total roughly 43,000. The week beginning May 6th, we double it, 14,000. And again, you'll see the number doubling down below. That's the weekly total. We go to May 13th, we're up to 18,000 per day. These are per day now. May 20th, we're up to 20,000 a day. May 27th, 22,000. Now, these are what we think we're going to be able to achieve. But we think we have a real shot at getting those numbers and being able to come up with that much capacity to test. So, again, in May, a lot of interesting things are happening, and things that we've been waiting for things that we've been trying to get going. Last week it kicked in. Let's go to tracing. We talked last week about tracing. Tracing and testing go together. And the tracing, as the doctor explained it last week, is something that health departments have done for years. Nothing new about tracing. Simply trying to break that, separate people, so when someone has it, someone's been exposed to it, then they don't expose someone else. It's kind of basic. And it's, again, something that our 113 health departments know how to do. But the challenge is they've never had this many to do. This is at a scale that we've never seen before. And so, if we're going to move the economy forward, open things up, we've got to be able to do the testing, we've got to do the tracing, and you all have got to continue to do the separation and all the things that you have been doing. So, this is the contact tracing workforce. It takes people. Starter at the left. We have about 685 local public health workers at local health departments around the state of Ohio who are trained to do this. They're there. But that's not, clearly is not going to be enough. So we have, right now, under Tier 1, we see Tier 1, we have about 900 volunteers. These are people who have been doing other things. They've said that they could volunteer to do this. And we are using, some of the local health departments are using some of these volunteers now. But we know that this could be with us for a year, 18 months, and that this tracing is going to have to be done over a long period of time. And so hiring people for the long haul is probably where we need to go. So we're getting money to go to each of the health departments around the state so they can hire people to do this. We're going to bring in the training to train them. Again, this goes back to Partners in Health, the group that I told you about. They will come in and help us train these workers. This is a pool that we're putting together at the state level. And Tier 2 and Tier 3 are really occurring simultaneously as we move forward through the month. What is that group for? It's for if we have a nursing home where we have a number of people who have the virus, or if we have something else in a community, a village, somewhere else where the local health department is just overrun, we will be able to surge people in there to make a difference. Our aspirational goal, June 1, 1,750 workers in process. So again, a lot of things we believe will happen in May. And the tracing, the testing enables us to move forward, to start back, to open up the economy even more. I don't think I have to tell any Ohioan the importance of moving forward. My heart aches for the businessmen and women who have not been able to work, who are looking at savings going down every day. The people who work in those businesses, people who are unemployed. One cannot overstate the tragedy of this. So we've got to get moving. We've got to get people back to work. We've got to open things up. And at the same time, we've got to protect Ohioans. So let's talk about how we are going to move forward. And let me just say, add one more thing, and the Lieutenant Governor the other day did a very, very good job talking about this. There are many health results when the economy goes down, and they're not good. Depression goes up, domestic violence goes up, and I could go on and on. So these are things that are directly related to people's well-being, directly related to their health. The anxiety of not having a paycheck, anxiety of not knowing how you're going to take care of your family. So these are all things that impact people's lives. We've talked a lot about, and I know a lot of speculation in the news media and among people, when we're going to open this up, when we're going to open that up, what's it going to be? And those are all logical questions. But I think the most important question really is how we do it. Because if we do it right, we can provide as much protection as we can. There's always risk. Much protection as we can to our workers. Much protection as we can to everyone involved. And so the how is very important. Let me start with our first announcement on May 1. We're going to have a health care opening. I want to talk a little bit about why we had slowed things down at hospitals. On March 17th, Director Acton issued an order in regard to non-essential medical procedures. Why was that order issued? It was issued because we needed to make sure that as the virus continued to spread, that we had enough hospital beds to take care of it, that we had enough personal protection equipment for our first responders, our hospital workers, people in nursing homes, et cetera. And we also wanted to make sure that we were having the social distancing. Well, again, you all have done a great job. The hospitals are not full. We have space. Done a good job of the social distancing. The one area that is still not quite where we want it is personal protection. It's coming. We've stood up more sources in Ohio and other places. We've secured more of this. But it's not exactly where we want it. And that is the thing that we remain concerned about. But we have a team that works on this absolutely every single day to try to secure more of the personal protection equipment. Our order that we're issuing for May 1, all health procedures that can be done that do not require an overnight stay in a hospital, we will be able to move forward with those procedures, operations or procedures. And I would ask you to remember that under the old order, when surgeries were necessary, even if the person stayed overnight, those were still allowed. For example, and this is from the order that was issued before, a threat to the patient's life if surgery or procedure is delayed. Those have always been allowed. 2, a threat of permanent dysfunction of an extremity or organ system, or possibly the spread of cancer. Those have certainly been allowed all through this. 3, pain. Someone has significant pain, and there's a procedure that can be done to alleviate that pain. Those have always been allowed. 4, the presence of severe symptoms causing an inability to perform the normal actions of daily life. So those have all been there. So we build upon those and then include any procedure that can be done where the person does not spend the night in the hospital. We also, dentists, veterinarians should also, beginning May 1, be able to be at full steam ahead. So all of this occurs on May 1. The only thing that is left is some elective surgeries, and as we see how we're moving forward and the availability of PPE, we will, when that time is appropriate, open that up as well. But this is a major change. And I know Dr. Acton will talk in a little bit about something that has occurred not as a result of our order, but something that has occurred because people have been afraid. People have been afraid to go to their doctor. People have been afraid to go to the hospital. And so, irrespective of these orders that have never blocked that, we have seen, for example, well baby visits have gone down. Many things have gone down. And Dr. Acton is going to talk a little bit about that and the importance of kind of getting back in the game in regard to making sure your children, making sure yourself are having the appointments that you need. I want to move now to May 4th. May 4th, manufacturing, distribution, and construction. That will be opened up. As I said, we've learned a lot from businesses that stayed open. And some of the things that we have provided in this order, we've learned, frankly, from business. But again, it goes back what we're going to require of the companies that open up, and also any company that's already open. When these orders go in on May 4th, this will apply to any manufacturing, any distribution, any construction, whether it was open before or not. Again, what I think people should look at is how we are doing it. And we're doing it in as safe a way as humanly possible based upon what we have learned and what health experts have advised us. So let's look at that chart. In fact, before I do that, let me call your attention to this one, because this one, COVID-19, responsible protocols for getting Ohio back to work. So these will, by and large, apply to any company that will be opened up under today's orders or future orders. And we've kind of done it, the goal, protect the health of employees and customers, their families, support community efforts to control the spread of the virus, lead in responsibly getting Ohio back to work. Protocols for all business. One, and we've summarized it in kind of a little quote here, no mask, no work, no service, no exception. So every employee will have to have a facial covering. And again, these don't have to be fancy, but a facial covering is very important. Require face coverings for employees and clients and customers at all times. Two, conduct daily health assessments by employers and employees, self-evaluation to determine if that person is fit for duty. Three, good hygiene at all times, hand washing, social distancing. Four, clean and sanitize workplaces throughout workday and at the close of business. And over here, limit capacity to meet social distancing guidelines. At a minimum, no more than 50% of the fire code. And it says here, use appointment setting where possible to limit congestion. Again, that depends on the nature, obviously, of the business. Take the following actions when a COVID-19 infection is identified. Immediately report employer or customer to the local health department. Work with the local health department to identify potentially exposed individuals to help facilitate appropriate communication, contact tracing, and shut down the shop floor for deep sanitation if possible. So these are kind of the basic principles. Wanted to put it on one page so people could just look at it, see it, pretty easy to understand. So these will all be up on our webpage, I believe, by 5 o'clock, 3 o'clock. 3 o'clock, I guess, they'll be up. So they'll be up on our webpage, and people can look at them. Now let's go directly to the manufacturing. And again, these are very, very consistent with what was on the more general slide that we just had over here. Let me just say a couple of things. Again, it's basic principles. Distancing. People have to be kept apart. If they can't physically be kept apart, there's got to be a screen, there's got to be something that can protect them. We've seen businesses, manufacturing companies that have been able to do every single one of these requirements. Many companies that are out there today are actually doing. And again, you'll be able to look at these and up on the web page, and any manufacturing company who's looking at that May 4th date, distribution company, construction company will have all of that available. Let me also say on May 4th, general offices will be able to be open. This is the chart for that, or it will be in a moment. That's the, and I'll just call attention to several things on here, but to me the most important is companies have found out that many of the members of their office can work from home and be just as efficient. We are asking companies as they go back into their office space to continue to do that as much as humanly possible. Continue to have people work from home. Again, we are all in this together, and what they do is going to allow us to move forward quicker as far as the opening of Ohio. So personnel work from home if at all humanly possible. Let me go now to May 12th. May 12th, consumer, retail, and services. Again, will be up on the web page. It's pretty simple. It is one page, but maybe call your attention to several things that are in fact up there. One, all employees will wear facial covering. The same thing will be true in regard to customers. So we encourage every Ohioan when you're out in public to wear a facial covering. We are not going to mandate that, but when someone as a customer goes into a business, they will have to have that facial covering because they will be dealing in a retail setting and they will be dealing with the people who are working there. And the thing that we have learned, that Dr. Acton has talked a lot about, and several of the doctors who we've had Skyped in here have talked about, is that really when you put that on, facial covering, you're protecting the other person. And so when two people do that, each one is protecting the other one. It is not a substitute for social distancing, but it is, as Dr. Acton has said, like the Swiss cheese, we just keep layering things on. The more things you do, the more protection that we provide. So this may be a little different, walking in to a store, but all these requirements, of course, will be in place for companies that are already open. For example, the grocery stores that have been allowed to be open. When we get to May 12th, every retail outlet that is open will have to be able to follow these particular protocols. Let me add a couple more things before I turn this over to Lieutenant Governor. The stay-at-home orders will still be in place. Now, obviously, they're modified in that companies that are now open, people who are working the companies obviously will be able to go there and work. The same is true with retail. When the retail is opening up, anybody who wants to go to the retail obviously is going to be able to do that. The gatherings, 10 people gathering ruling or order is going to remain on. So I think you can kind of see what we're trying to do. We're trying to ease out. We're trying to get Ohio back working. We know there's more things to do. We need to see how this works. We need to monitor the numbers. We need to see how our tracing and our testing is going. We believe we can live up to those goals that we put up there. So a lot of moving parts, a lot of things going on. This is the beginning. But to be able to do it and to continue to move forward without occurring something that no one wants to see occur. And I've had businessmen and women tell me this, and average citizens tell me this. We don't want to go back. We don't want to open things up and then have to fall back. We don't want to see a huge spike in hospitalizations. We don't want to see a huge spike in cases. The virus is still out there. It's not going to go away. But there are a lot of things we can do to lessen its impact, and we've been doing those, and we just have to continue to do those. At the same time, We're trying to get folks back to work and make that happen. I want to call special attention to the people who are the most vulnerable. And again, Dr. Acton may talk a little bit about that. But as we look at who is the most vulnerable, we have to start off with, if you look at deaths, the deaths have not been nearly as high. They've been much, much higher, obviously, the older someone gets. And they go up when someone has a medical problem. Anybody can get this, it would appear, and anyone can be ill. And if you look at national numbers, you'll see that even younger people can die as a result of it. But we do know that those 65 years of age or older are in a much, much more difficult situation. We know that anybody with chronic lung disease, moderate to severe asthma, severe obesity, diabetes, chronic kidney disease, undergoing dialysis, liver disease, and on. So those individuals, again, we just would remind you to be exceedingly careful. You are at much greater risk if you get it, as far as what can happen. So again, let me thank Ohioans. We've gotten this far. We've got a ways to go. These are first steps. First steps in regard to retail, first steps in regard to moving forward with manufacturing, with office, with the medical side. These are things that we've been waiting to do. Because of what you have done, we are now in the position to do them. I know there are other things that all of us want to do. People want to get a haircut, get their hair cut. People want to go back to restaurants. And all those things we're anxious to do as well. But we've got to see how we're doing with these numbers. We've got to watch it for a few weeks. But we've already started conversations. I had conversations Saturday morning with some folks who run restaurants, own restaurants. We've had started conversations with people who cut hair, and those conversations are going to continue, and we're going to get those online as fast as we can. And I'm also aware, certainly, as a grandfather and father, there's a lot of things that we all want to do this summer. There's a lot of things, summer camp and other things that kids want to do, and that adults want to do. We're not quite there yet. We've just got to see how this is going to work. We've got to see how the numbers look. We don't want to go backward. So one step at a time, but I think we were set for May to be a very good month as we move forward with the testing that we have, with the tracing, and with all of you doing what you've been doing. Lieutenant Governor.